Question 1. Would I have the scar after the wound healed? Do you mean whether you have the scar, not just keloid or hypertrophy scar, right? Yeah, that is one of the most frequently asked questions in my practice. First thing first, you need to know what scar is. The scar is usually composed of fibrous tissue, which forms to replace the damaged skin. After you sustain a wound, your body will start to process to close it. It is because the skin is the first barrier to prevent harmful external factors, such as bacteria or viruses, from entering your body. There is no evidence of scarless wound healing in humans except in the fetus. Most researchers and plastic surgeons now focus on minimizing scars and preventing bad scars like keloid and hypertrophy scars. So, when your wound is healed, it will leave a scar, which is natural. The scar is usually stabilized in 12 to 18 months. Please follow our instructions to minimize the chance of developing keloids or hypertrophy scars. It will take time, especially in applying the scar cream. Please keep in touch with me to achieve the best aesthetic results. Question 4. What are the chances of flap or skin graft necrosis? Your concern is reasonable, since there are always flap or skin graft necrosis risks in reconstructive surgery. Necrosis is the death of body tissue. It occurs when too little or no blood flows to the tissue. This can be from injury, radiation, or chemicals. Necrosis cannot be reversed. The chances of flap or skin graft necrosis depend on several factors. It can be advanced age, diabetes, wound infection, smoking, or hematoma or seroma formation. The flap transfer failure rate depends on the flap size. The skin graft failure rate is 2 to 30%, which varies between facilities. In our institute, 4 to 5% of patients experience skin graft partial failure. Your wound is clean and ruddy, which is suitable for surgery, and we will do a full thickness skin graft to cover your wound in 2 days. And as I mentioned earlier, the skin graft failure rate in our department is 4 to 5%, but that happened in patients with advanced age, diabetic foot, or smoking history. You, on the other hand, have none of those risk factors, so your chance of skin graft failure is much lower.